It is with great joy that I welcome you all to Activate Your Impact, Silicon Valley's very own nonprofit policy and advocacy summit. We are using the meeting feature today, so be sure to utilize the chat box and those fun Zoom reactions down below throughout the remainder of the event, and to really just show the speakers some love. And with that, I'd like to start off by thanking all of our sponsors for today's event. Special thanks to Kaiser Permanente, Santa Clara Family Health Plan, the Health Trust, First Five, Stanford Children's Health, Lucille Packard Children's Hospital, Stanford Healthcare, the Housing Authority, Healthier Kids Foundation, and Loani Nguyen. And I also wanted to say, but the session that I'm about to introduce is actually the fourth of 6 sessions designed to lift up powerful advocacy stories, just like the ones that you'll hear today, and to give each of you the necessary tools and information needed to be the change makers that you're all capable of being, especially in this pivotal time. Now, if you haven't been able to catch any of our prior 3 sessions, don't worry at all. Each event during our policy summit will be recorded and shared to each of our registrants in the following week after the completion of the entire AYI event. So hang tight. Now, just in case you're not familiar with SVCN or the Silicon Valley Council of Nonprofits, first off, welcome. We're super happy to have you join us all today. But second of all, please go ahead and check out the links that my colleague will be dropping in the chat. Using these links, hopefully you can find out more information about what exactly a nonprofit alliance is, and how exactly to join as a nonprofit member or an ally member with SVCN. And we have just a few more housekeeping items that we wanted to go over. If you like today's Advocacy Stories panel or any of our next sessions before or after this one, we'd love for you to be actually able to share your own AYI experience on social media. To do so, please make sure to use hashtag AYI21 as the hashtag and make sure to tag SVCN so we can be sure to see it. Next, our panelists will be conducting a brief Q&A towards the end of the event. At that time, please make sure to use the Zoom raise hand feature if you have a question for our panelists, or you can leave it in the chat if you prefer us to read your question, or we welcome you to come off Zoom, because the benefit of having this meeting feature is so we can actually have that conversation as opposed to the webinar feature. So otherwise, please remain on mute in the meantime. And then next, for accessibility purposes, if you prefer to read captions or a transcript of what exactly is being said today during today's event, please make sure to look on your Zoom. Please click on the Otter AI feature, which you'll find at the top left-hand corner of your screen. This is an accessibility transcribing feature, and all that we ask is that you actually just state your name before speaking so the caption feature can best identify you. But overall, this meeting is going to be recorded for registrants and members who couldn't make it today. So you can feel free to reference that later on as well. Now for the main event. So without further ado, we have a lot of good stuff in store for you all today. And it is with great honor that I actually introduce you to our amazing rock star moderator for today, Maria Noel Fernandez. Maria Noel actually stands as the Deputy Executive Director at Working Partnerships USA, and she will be leading us in today's discussion and as well as introducing the rest of today's panelists. So with that, Maria Noel, the floor is yours.
Awesome. Thank you so much, Alan. So again, I'm Maria Noel, and first just want to say thank you to the Silicon Valley Council of Nonprofits for putting this conversation together. I'm looking forward to the conversation with a set of local leaders who I am first so grateful for their leadership, for their sisterhood, even though they're not all sisters, but really for the hard, real work that they do with and for our community. So the prompt today for these folks is to share with us their advocacy stories. And I just want to name that if we had these folks tell all their battles, all their scars, and all their stories, we would be here for a while. So today is really meant to be a flavor for you all and an invitation for folks who may be thinking about their next advocacy effort to really reach out to any one of us and engage and ask us all the hard questions. When I was thinking about today and this conversation, I was reminded of Audre Lorde's words, which I am often reminded of Audre's words. And Audre said, "Sometimes we are blessed with being able to choose the time and the arena and the manner of our revolution. But more usually, we must do battle where we are standing." Some of the stories you'll hear today are about years of campaigns in the making, but most are about being called to leadership and work because the moment called us to do it. And with that, I am really excited to be introducing one of, or actually two amazing leaders, Jen Loving and Darcie Green. And I'm going to ask both of you all to please tell us about yourself, your organization, and the role that you serve, and then we'll get into it. How did you, your organization, or your advocacy effort really move the needle? What is your advocacy story? Jen and Darcie.
Hi, Maria.
Hey.
Thanks for having us today.
Very, very excited to be here.
Darcie,
Jen, I was going to let you go first since I'm going to lay the groundwork for this.
Okay. So I think Darcie and I, my name is Jen Loving and I work at Destination Home, which is has been an organization that works to end and prevent homelessness in Santa Clara County. And I would say literally about 12 months ago, we began a journey with our community that has resulted in keeping almost $100 million of money locally controlled and programmed and designed to serve really the lowest income communities of color in Santa Clara County. And I'll say that we didn't know that was what we were doing 12 months ago. But I think the advocacy work and the systems work and the partnership work along the way is now we can look back and see why the decisions that were made were so important. Now leaving us sort of in the position that we're in today to hopefully continue that work.
12 months ago, we were an organization existed pretty much solely to serve the Latino community around issues of cancer. And very, very small pieces of our program work went toward financial assistance for our clients who were finding difficulty accessing the healthcare system or who were finding financial issues as a barrier to prioritizing their care. And by mid-March, we had, actually by the end of March, we had our first cancer patient client call us saying that they had lost their housing and their income in the same day. And they were a single mother and living in their car and couch surfing. And so we knew at that point, just being aware of health disparities in general and knowing that whether it's the pandemic or any other chronic condition, disease, emergency always disproportionately impacts the low-income Latino community that we serve. So we were able to pretty quickly understand that our clients were in for a tidal wave of despair and devastation because of this pandemic. So we tried to look around to see, we called other cancer serving organizations, we called other partners who were more within the realm of the work that we did. And we found that it wasn't really an issue to anyone else but us because we were the only organization serving the low-income Latino community. And so we tried to then seek out partners outside of the work. And that's how we became aware of the work that Destination Home was doing because our clients were quickly becoming unhoused and we had nowhere to go to serve them. And it wasn't something we normally did, but we knew that we needed to meet that moment and we needed to meet the needs of our clients. And at that point, the biggest health disparity our clients were facing was housing.
And talk to us a bit about this piece around working together on it. Like, how did you all play to each other's strengths and weaknesses through the effort? And tell us about what you were really able to accomplish together.
It's such a great story, and so many people on this call actually were a part of it. So, when I say we, I mean 70 organizations, the city of San Jose, the county of Santa Clara, all kind of together on this. And what I mean by that is Destination Home and Sacred Heart and all of the homelessness prevention, the emergency assistance network partners have been working together on homelessness prevention, on a homelessness prevention effort for several years. So when we realized what was happening, we already knew that the disproportionately families that were becoming homeless were extremely low income families making 0 to 30% of area median income. And we knew that a little bit of money could go a long way. And so that work had been underway. We thought we would help about 1,500 families this year. true story, like a year ago, and we've ended up helping 15,000 families, right, through the strength of this partnership. So we went into quick action. We knew that we needed more money than we were thinking, because as everyone was losing their jobs, that this was going to be just even one paycheck. We already knew what that would mean. And so we started by just expanding that homelessness prevention system, but we actually started working before the stimulus had come out. And so when the previous administration released their stimulus plans, it was unsurprisingly and also very clear who wasn't going to get helped. Communities, undocumented families, people that couldn't qualify for unemployment, they're going to be left out of the stimulus. So, and then we said, oh shoot, well, we have this wider net of people that we have to serve, and we are not experts in this. We have our homelessness community, but we're not experts in the broader community. And so we said help, and our help was Zulma Maciel at the city of San Jose. We said, Zulma, help us. And so she said, let's bring community together. Brought folks, Darcie and lots of others, Milan, lots of folks on this call. Sorry, that's my dog, together to talk. And basically the community said, our families need money, to exactly to Darcie's point, our families need money and they don't need a lot of hoops. And they went and actually talked to families, and families said, we need like $1,000 and we want to get it from people that we trust. And so we said, oh, okay, so let's do that. And so we partnered with any organization that wanted to partner with us to distribute cash. And that's basically what 70 organizations did. So the team at Destination Home really just helped on the sort of the framework, but the effort made by 70 different organizations to get money directly into the hands of people who need it. That went on, now is still going on right now, right? Up until like, well, we can talk about like what the future of rent relief looks like maybe in this conversation, but like long story short, $36 million went to 15,000 households and was distributed through this community approach. And Darcie had been with us every step of the way.
I really feel like this is like a get off mute kind of a moment, but because really, I mean, this is just like amazing, amazing work. And like, again, there's so many folks in this space that I know made it happen and worked with you all, and just want to really call out. Just amazing work. Darcie, your thoughts? Yeah.
I wanted to add to that, so the advocacy piece for us, we're patient advocates. That's what we do in non-pandemic years, right? So we already advocate on behalf of patients who are experiencing health disparities. So this advocacy quickly pivoted toward rent relief. And we went to many different places trying to figure out how could we get rent relief for the medically vulnerable that we serve. And we just couldn't wrap our minds around that the county would just allow the medically vulnerable to go unhoused, or allow the medically vulnerable to just quickly become with their children living in their cars or couch surfing. And we were very unfamiliar with the issue of housing in general, and the issue of homelessness and serving the community that was unhoused. And the reason I bring that up is this was not only a pivot, as it wasn't a pivot from our mission, because our mission is to serve the Latino community around issues of health disparity, but this was a big programmatic pivot for us. And I don't even know if Jen knows this, but combined with the direct assistance that we passed out in phase, whatever phase was in the summer where we gave away the gift cards, if you combine that with the total amount of rent relief that we were able to process in the fall, we gave away in rent relief what is our normal operating budget. So when you think about how is that possible for an organization like ours that is small, that prior to this was seen as a very single issue organization. We work in the area of cancer, but we knew as an organization that cancer is not a single point issue. Health is not a single issue. People don't live in that way. All of these social determinants are very connected, and access to quality housing is absolutely a social determinant of one's health, and it impacts someone's diagnosis for chronic condition. But when you think about how an organization as small as ours, we're also a part-time organization. We've been a part-time organization since our founding. So how an organization like ours could rise to the occasion and serve so many people in providing rent relief and direct assistance in the amount that was equal to our operating budget, that came through advocacy and partnership and the effectiveness of this grassroots effort. And we still are just amazed by what was made possible by this partnership for our clients and for us as an organization.
I mean, look, the bottom line is community knows what to do with money, and we, for some reason, refuse to make it available. And we don't need to have research and studies and think tanks and endless conversations about the fact that we need to be putting as much money as we can into the lowest income community as we can, so that they are able to solve the same problems that we all solve, you know, and have the right to solve every single day. And instead of, I think the thing, if I could say the thing that I feel proud of at Destination Home, and when I say that, I mean the team of people under Chad Bajorquez that worked on this and rolled this out. And it was really, you know, I don't know if folks know, but Destination Home only has now 12 people on our whole staff. And so most of the folks that had other jobs a year ago pivoted, right? We all just made an intentional decision that we had to respond. And so people that were not used to doing this, were doing this, you know, my whole team. And what I loved about the approach was, we're not the experts. We're going to trust the community. Darcie told us, we need this, well, we need the money for this. And we're like, please, great, do it. Please do it, you know, because your success is our success. If families are getting what they need, and by trusting the community, Maria, which is the thing that I love the most, is 94% households of color got this money. If you think about that, extremely low income households, almost 80% of the whole effort of $36 million. But if you look at where the money went, it overlays a third of all of that money went to the highest zip codes with the highest rates of COVID in San Jose. That was not on purpose. That was because community knew what to do.
That's right. So, you know, I think I actually have a whole bunch of questions. I'm sure folks do too. But one of the questions that comes up for me is, I am sure you got some pushback. I'm sure it wasn't easy. I'm sure there were some challenges in this story. And so I'm going to introduce a couple other panelists to share kind of the overview of their story. And then we're going to have some time to go back to that. So just have that percolate in your brain. What do you want to lift up as challenges and what was hard about this? Mathew, you're up. Who are you? What's your story? Tell us about you.
Yeah, I am Mathew Reed. I'm the policy manager at Silicon Valley at Home. And I'm going to tell you a story that actually pivots perfectly from the discussion you just had, because part of my story is acknowledging the heroic work that folks like Darcie and Jen have been doing to respond to this crisis and the real dire community needs and being responsive to those needs. So what I'm going to talk about is a campaign for opportunity housing in San Jose, which is the idea that we would allow 2 to 4 homes to be built in areas that are currently restricted to only single family homes. Currently 94% of the land where you can build housing in the city is restricted to single family homes. That means everybody else has to fit into the extra 6%. It's making things really hard. We need more different homes in more different places for more different people. And we're failing. Frankly, we're not doing a good job of that. So this is a really important issue, but it's also a really difficult time. And it brings me back to your quote, Maria Noel, from the beginning, Audre Lorde. My paraphrase is that we don't get to pick when important stuff comes up, but we do have an obligation to each other to respect where people are at and pick up the pieces where appropriate to make sure that collectively we're pursuing interests that are important to us. And so as everybody else is trying to respond to the immediate needs of the community, we've tried to pick up and carry along this broader goal of trying to break down walls of exclusivity in the community and in our city. And when this started, in July, there was a city process. We circulated a statement and had 26 community serving organizations in the city acknowledge that in the context of the Black Lives Matter actions that were happening and the kind of reckoning we were experiencing as a city, that one of the most significant places where we can see inequities today is through the way that we zone our cities. And historically, along with other policies that sought to discriminate, against low-income families and communities of color, single-family zoning was created with the explicit intent of segregating communities and controlling access to opportunity. We were all on board with that statement. I made a lot of calls. People said we're still on board, but you know what? Every day I'm working hard to make it through the day and serve my people, and let me know when you absolutely need me, but I can't invest all of our organizational efforts into this right now, and it's really important. And so I think my story today is, how do we be accountable to each other as a community and respect the work that everybody's doing, but also find our lane and not let important issues get dropped off the table.
Wise words there, Mathew. I now want to invite Milan and Helen from the African American Community Services Agency. Introduce yourselves. And again, we're going to come back. Don't think we're done with Mathew either. We're going to come back to Mathew, Darcie, and Jen. But Milan and Helen, tell us about yourself and your story.
Hello, and thank you for having me and my dynamic partner in crime, Helen. My name is Milan Balinton, and I serve as the Executive Director of the African American Community Service Agency, also known as a Chief Possibilities Officer.
My name is Helen Kassa, and I'm the Policy and Advocacy Coordinator at the African American Community Service Agency.
The African American Community Service Agency was founded in 1978, serving Santa Clara County and doing every and anything that we can do for the people.
So, Milan, Helen, tell us a little bit about, kind of how you all came to this moment. Like, what's the story you want to tell?
Thank you for asking the question. For those who are actually paying attention and woke to what's going on in their world, in addition to the pandemic, the Black Lives Matter movement was something that, as a leader and a young Black male, Black and Filipino, for those who may not know, to be able to, and oftentimes in leadership, it's like, here's the mic, here's the platform, run on, run in front. But I took a different approach in regards to the vision of looking at it from the lens of what are the people saying, what are the hurts, what are the harms of today's generation that our ancestors and our grandmothers have fought for decades to make sure that we move the needle even further. And so being around young people like Helen, who has been, I think she's been advocating since birth, if you ask me, I said to myself, we have to make sure that young people and our seniors are all on the same page, but how we're writing the story going forward and with what tools. I mean, when you look at what Black Lives Matter is doing on a national level, well, here on the ground is your AACSA, the hub for the community, to find out where our Black churches are, historically fraternities and sororities, and getting the information to our people. Because oftentimes in meetings, people say, well, it's less than 3% Black people. But we've been in Santa Clara County since the 1700s, making and creating pathways. And so that's what led to us requesting funding from organizations such as the Health Trust, Heising Simon Foundation, Silicon Valley Community Foundation, to develop the policy and advocacy arm of our organization. And although the agency has 6 pillars, our new policy and advocacy coordinator, Helen, has helped us shape that framework, which alleviates me as executive director of my time constraints. And Helen?
Yeah, so I'll definitely add to that and say, Milan kind of touched on it. Although policy and advocacy, this role in itself is new to the agency, advocacy is not new to us. We've always been engaged in it. And I think the cool thing and the amazing thing about what Milan did in terms of advocating and rallying to make this full-time position available is now we have a targeted individual, and I have now 2 interns on top of that, which is exposing students and training our next generation of leaders, to stay on beat with what's happening in the county, what's happening in the city, and what are the needs of our community. Since we are a service-based organization, we have our ear to the ground with the needs that people have, the frustrations that people have, and making sure people are aware of what's going on. For example, one of the things that we're following is the Charter Review Commission. The other things that I'm sitting on a few task forces and commissions like the Community Law Enforcement Monitoring Commission, which is very, timely with everything that's been going on, and kind of trickling the information down so people are able to, have the advocacy opportunities available to them. And so I think that is the greatest thing. And like Milan said, the agency is sort of a hub for all Black organizations, and it's a way for us to build stronger symmetry with all the other organizations and, create the changes that we're looking to make. So I'm very excited about this role, and yeah.
Wonderful. I mean, I think that's very real for so many organizations. So many of us is, you gotta choose, like, what do you do with that valuable funding? And the fact that you all have made the very conscious decision to make this role possible, I think speaks to a lot of the values and the real work of the African American Community Service Agency in our community. When you think about some of the challenges over the last year in your advocacy efforts, what would you lift up for the group here? Do you have any?
There's so many today. And it's a beautiful thing to smile today about, we've advocated for several things. For those who might not know, the AACSA is one of the only multi-service African-American centers left in Northern California. So when it comes to, as Helen can speak to, mobility, when it comes to our senior citizens getting access to close the digital divide, when it comes to health and equity, which is the task force I'm serving over the city, we are at the table discussing many different topics, having to be very transparent and transformative and getting the message. And as we talk about stories, you can go to AACSA's Instagram account and follow our stories in regards to how we are making it palatable to the current generation. But we're also hosting Zoom parties for our senior citizens in our community to not only get their physical health, but their knowledge to know what's going on the front lines. And then when it comes to Black immigration, which Helen can speak a lot to that, and making sure that that oftentimes what goes under the radar is our Black immigrants. So we have been having discussions, right, Helen, with our staff, our board, our community, in order to make sure that we are on the front lines.
Yeah, absolutely. And, we've been actually working on a lot of things, as Milan said. So as of recent, exactly what Milan said, it's like sometimes our African and Black immigrant community is left out and forgotten. So we've been holding policy forums and sessions to have discussions on what are the priorities and how are we being left out. Because for that specific example, when we discuss, the migrant community, it's often used synonymously with Spanish speaking. And that sometimes makes it so that, resources are not really being tailored for African immigrants in terms of language resources and so on.
Wonderful. I want to now open it up a little bit. Thank you so much, Helen and Milan. And I want to invite folks that are listening in to really be thinking about what questions you all may have for our panelists. Start throwing them in the chat so you don't forget. But also in a minute, I'm going to ask you to come off Zoom or invite you to come off Zoom. But one of the questions that I wanted to pose to everyone on our panel today, we heard a little bit about how racial justice informed your work and the story that you're lifting up today, but can you really put that forefront? Like how was your work informed by racial justice principles, and what did that mean for your efforts? Like what did that tangibly mean for how you made your program work or your advocacy effort work? And whoever wants to go for it, go for it.
I can start by saying that we are at our core a health justice organization. So we are a justice organization serving the Latino community around issues of cancer. But what that really means is that we're working to increase health access. And we do it from a standpoint of recognizing that the fact that social and health inequities even exist is a choice we make as a society. There's no natural occurring reason that the Latino community was disproportionately impacted by COVID. There's no natural occurrence kind of reason that any of these disparities exist. They exist because of public policies that have reinforced systems of white supremacy, public policies that reinforce racism, public policies that reinforce social and economic inequity, and as a result, health inequity, or this all exists because of a lack of public policy protecting the most vulnerable. So our viewpoint on our patient advocacy, our viewpoint on health education, our viewpoint on how we show up for our clients is from that lens of recognizing that our clients deserve quality healthcare, and they don't get it, not because of their inadequacies, but because our healthcare system is inadequate. It doesn't properly and adequately meet the needs of the people that we serve. So that's why it was very easy for us to pivot during the beginning of the pandemic to meet the needs of our clients around issues stemming from COVID-19, because those are mirror image issues to what our clients were already facing. We were already serving cancer patients who were becoming unhoused because of cancer, and our society was cool with that. So we were already in that frame of mind of people deserve housing, and people deserve quality healthcare, and people just deserve quality wage, and people deserve what they need to live because we're human beings. So that's a justice standpoint that we were already at, and that frames our advocacy. So we in the cancer space, though, that's a rare thing, right? So that's not something we talk about often in the cancer space. So what was really great about our partnership with Destination Home was when we were looking for organization or partners within the cancer space, we weren't able to find any. But because of Destination Home bringing together 70 organizations to work on this issue, we were able to make partnerships and friendships and relationships with other organizations that were also justice-minded, serving similar populations who really got it at the end of the day. So it helped us institutionally as an organization as well to find our lane and to find like partners in this work. And we've, as an organization, been forever changed by this level of advocacy. And now we've been just recently funded by the Silicon Valley Community Foundation to cement our advocacy work in trying to be an organization that not just helps people navigate health disparities, but we want to really be an organization that helps our clients eliminate them for themselves.
Amazing.
I would say, if there's still time, one way for us was, learning from what we already know, which is the disproportionate number of households of color that become homeless and the income levels that those households make. So focusing on extremely low income housing is in of itself a race equity strategy, right? And that bore itself out in the results of what we've been talking about. So if you want to move the needle, the money and the resources need to go to where the communities are, right? And then the second, I think, was really just trusting our leaders to know how to actually get that money out the door. So, I think there's always ways for us to learn and do better, but it felt like we just listened and used the data that we already had, right? About where do we already know people are falling into homelessness, right? And the disproportionality. And I think so many times we don't, if we want to solve the problem, name the problem, right? And then solve that, don't set up something tangentially that isn't going to do that. And that's the mistake I think we make too much when people that are farther away come up with the idea, a funder has an idea of what should happen. Well, anyways, it's done better when it happens together.
Absolutely. Milan, Helen, Mathew, anything to add? Racial justice and how y'all have centered that?
Yeah, so I don't mean to speak for Milan, but with the African American Community Service Agency, as Milan said, we have several pillars, health and wellness, economic development, education, racial and social justice, family resources, and homelessness prevention. And with all of those, I think the unique thing about our agency is that everything that we target, we look at it through a racial justice lens. So when we're looking at education, we're looking at how can we move the meter forward in terms of equity for, our most marginalized members of the community. And we carry that even when we're looking at, of course, health and wellness in the midst of the COVID-19 pandemic. We're partnering with organizations who have resources or, like, for example, COVID vaccinations to make sure when we're looking at the statistics, I think it was like our population here is about 3%, but 2.4% of African Americans or Black people in Santa Clara County are being vaccinated. And nationally, country, it's like the population of African Americans is, or Black people are 14%, but about 5% are being vaccinated. So looking at why are we hard to reach? Where is the inaccessibility? We do the same thing with homelessness prevention. We do the same thing with education. I mean, right now there's the issue with, you know, the Santa Clara County Office of Education, and ethnic studies is being challenged. You know, is it necessary? And so with everything we do, we look at it in the sense that, you know, there's this, I studied political science in school, and there's this theory called curb cuts. And I know everybody on the panel is aware of it, even if you don't know the name. And it's this idea that when you help the most marginalized, when you help the people who are most impacted, everybody benefits on top. And the reason why it's called curb cuts is, like, you know, in the street, the little ramp. So it's like, okay, somebody with a luggage or a roller backpack or somebody who has hip problem, everybody will benefit from that little wheelchair ramp. And so it's that same principle. So I think that racial justice principles really are the centerpiece of everything that we do, and the driving force of what we do. So it's like, even when I look at policy and advocacy, it's like, it's not its own department, because we touch everything. And it's like, our homelessness prevention staff member talks to me about, you know, oh, there was this issue, but this doesn't necessarily, you know, really relate to the African American community, and that this should be, you know, resolved, or, you know, and so on. And so that's kind of how we do things. Milan, if you have anything to add to that. But yeah, policy and advocacy is so interconnected and intersectional with everything that we do at the agency.
And that's why we hired her. She is dynamic within her own right. And first of all, happy Women's History Month to all the women on the call, because you are all dynamic. So I always wait and let women go first. But when we talk about racial justice and racial equity, we're looking at systems. We're looking at white supremacy, as Darcie mentioned, and how do we create new systems to support the communities that are often talked about. You know, when we talk about even the Black community, for those who don't know, the agency serves a large population of the Latino community. And oftentimes people don't know that, but if you come to a lot of our programs, you'll see both of our communities getting the services that we need and that we need to provide. And so when we talk about mental health awareness and what policies are impacting when we're talking about policing, agency has advocated for funding to provide free mental health services and free therapy services, because currently with the pandemic mirroring what's been happening, where are people going? Who are they talking to? As Helen noted, when we talk about education, we're really focusing in on what is being taught in our schools to create equitable outcomes for students that are going through our school system here. And when we talk about homelessness prevention, thank goodness for Destination Home and all those partners, because AACSA was able to house families that look like me, who were staying in their cars with their children, like, where do we go? And being able to provide them with cash. We just said to them what the need was, and we were provided the money to be trusted to do it. And that left no strings attached. We can run the report, show where we put the money, but it was the people who were able to get housed and have their bills paid by us, for us. You can't create a better system, which is a relationship based on the grounds level. So I continue to encourage foundations and companies who are on here looking for ways and means to do that. Talk to Jen and the crew over at Destination Home, because they made that happen, and we do appreciate it.
Awesome. Thank you so much, Milan.
Yeah, sure, absolutely. I would just say, honestly, this has not been our strength as an organization. I think we have historically taken for granted the fact that the work that we did, disproportionately benefited communities of color and was a justice issue. But we haven't done a good enough job historically at making sure that that was at the center of the way that we talked about our work. It's a process. We are in the midst of it, and I think we're getting better. And I think so. Our lesson really, again, is a little bit of humbleness and recognizing that it takes work and respect. I think we try very, very hard not to mess things up when folks are leaning in, and I think our goal is to do a better job of leaning in ourselves. So
Maria, can I add one more piece about the
Please,
racial
yeah.
equity piece? Because I think there's the racial equity work that we're doing as service providing agencies and advocacy organizations on the ground. But then there's also the racial equity work as funders. And I'm not a funder, but I'm talking about being an organization that's led by a person of color serving people of color. And that was another big story that came out of last year, and one that needs to continue far beyond the pandemic. And one of the advocacy pieces that I want to push for folks that are on the call, and also to just give recognition to Destination Home and the partners who really, because they infused so much flexibility, and because they took out so many of those barriers, it made it possible for organizations like ours that are deeply in a grassroots way serving the low-income Latino community, and we are staffed and run by folks who live in the communities that we serve. We would not have had access to that kind of funding otherwise. So another piece of advocacy we need to think about is race equity in how we fund nonprofits. And as an organization that serves the low-income Latino community exclusively, we know we're not funded at parity with other cancer-based organizations. And part of that is because we are serving exclusively the Latino community, low-income Latino community, and our constituents historically have not been as vocal. And cancer stories and healthcare stories have not been the same as folks who have more wealth, more access, and different lifestyles. So we also need to think about moving forward, race equity for the clients we serve, and also race equity for the organizations serving the clients that we're talking about. And Destination Home did that so well in really trusting organizations, regardless of our annual budget, regardless of our staffing, really trusting and believing that we had those meaningful relationships and we were going to get money out the door. And I think we were able to prove that in the numbers that we all showed collectively at the end of the year, just the huge amount of money that got out the doors and into in a pinpointed, targeted, laser focused way, the communities that needed it.
And this should not be a unique thing. If there's anything that the fact that Darcie and Milan and have to talk about this like it's unique, that they have to talk about like all we did was act like, I think, most basic thing, right? Which was to get out of the way. We knew that we could raise money. Great, we should do that and make it available. So that people can solve more problems. It doesn't have to be more complicated than that, but we've built a whole philanthropic industry on making it more complicated than that.
Yeah, that's absolutely right. That's absolutely right. And I think the question that I think I would leave to all of us is, what role are we all going to play as, both like folks of color and as, folks in the room that are white allies to make space to make sure that our organizations, small organizations, people of color-led organizations are getting the funding that they so desperately need and deserve. I want to go back to one of my original questions that I left you all with, which is to share with us, if you had to start all over, pandemic first hit, and you get to do this again. Let's hope we never have to do this again, but you get to do this again. What would you do differently?
Well, we actually are doing this all over again, Maria. So we're about, as a team, as a group, to administer $57 million in rent relief. And in fact, the RFQ for us asking for partners just went live today, yesterday. We sent out a newsletter today saying, if you want to do this with us, please apply. The challenge that is not a local, and the city of San Jose and the county of Santa Clara deserve so much credit for saying, oh man, what they did worked. So we're going to keep our money and keep it local so they can do more of that. The easier route would have been to take our treasury money for rent relief and give it to the state and put it in one big bucket. But the state's response is not as equitable. Ours is willing to focus in the same way because of what the people on this panel did, showed that it could be done. So we have a chance to do this again, but there's a couple caveats. And the biggest one is this money cannot go to people in the same way. We had flexible cash assistance to go to families, but this is all rental relief money, which means it all needs to go to landlords to the greatest extent possible, which is not at all the only problem that our families have at the, a year into this pandemic, right? They have lots of other debt and bills. So we're actually about to do this again because of the work, but it will be harder. It'll be harder to do, and we don't have the flexibility that we had. Meaning when Milan says we could just solve our problems, I wish that was the way it was going to still be, but this treasury money says it can only be used for like 2 different things.
So what does that mean from like programmatic, like how there's this new problem? So then like, what does that mean for how you were thinking about how to roll this out?
It means that we need philanthropy to still contribute flexible money, private money. So when Darcie, for example, I don't want to speak for you, Darcie, but as an example, you're saying to the family, okay, we're going to work with the landlord, we're going to pay the rental arrears, good, take care of that. And family has X amount of money they took a predatory loan or they haven't paid a medical bill or whatever it is. And then there's some private money that can go to pay for that. Destination Home's job in this equation is to raise that private money so it's available to be a companion to the $57 million that are not super flexible. Meaning if we're not paying off landlord debt with this money, that's what it's for, or utilities, but it's not for very many things.
And another example of why that is important too is many of the families we serve, it would put their housing in jeopardy to even go to the landlord and ask for this type of funding. They're in very informal rental agreements. They're living multi-family to one household, and many of those families are not on the lease. And if the landlord knew that they were getting rent assistance in this way, they may be in violation of their lease altogether, or they're renting couches or they're renting garages. So that flexibility is also a piece of race equity. That flexibility is also this idea of hyper focus, hyper local understanding of the social determinants of our health and our income. So without the flexibility for us as grassroots partners to work with Destination Home to find out from neighborhood to neighborhood, from family to family, what are the very individual circumstances keeping them from, one, paying their rent, affording their rent, two, being able to go directly to their landlord, or what are the other outstanding circumstances they have that are keeping them from staying housed and affording their essential bills. Without our ability to talk that through and not take a cookie cutter approach to every family, many of the most vulnerable families will fall through the cracks. And that is the perfect example of what historically has happened in this county for very vulnerable populations, when we've had cookie cutter systems that allow for families to fall through the cracks. So that's, if I could do something differently, I as an organization would just be more bold. I think in the beginning we were, can we do this? Should we do this? Are we capable of doing this? We're a little small but mighty team of Latinas. Can we could do anything. I mean, I think we took on a lot. I would go even bolder in our advocacy, even more bold in the amount of rent relief we want to get out, and I would do more to bring along our families to build their capacity to also be involved in the advocacy work.
Thank you. Mathew, Helen, Milan,
Yeah, that connects to, I remember when I was graduating from college and I was trying to figure out, like, where was I going to go? What was I going to do? I applied for programs myself through the system and got denied. So I know firsthand what it feels like to be denied. I'm like, I just need this month to get off of my feet, or I need this month to make it to next month. So I think differently what we would do is attack some of the policies and procedures that block families from getting that month assistance that they need in order to get them into the program to better understand their finances. Because oftentimes you cancel out folks who just don't know how to manage their money yet, which is, economic stability helps someone in our communities who typically working 2-3 jobs, going to buy something at a fast food place, and it's a repetitive behavior. But how do you know to cut back on that? But what happens is they get a rejection on their request for funding, and then it's a spiral effect that impacts the family. It impacts the whole community as a village. So looking at policies and eliminating them going forward is something that we would have done differently in the beginning. But again, we just got started. So you may see some things changing shortly.
Thank you. Mathew, how about for you all? What would you do differently?
Yeah, it was so evident from the very beginning that the relationship between what we were about to experience as a health issue and the housing issues we have in our communities were going to be so intertwined. And I think, you know, Jen and Darcie were at the middle of trying to address that immediately. I don't know that we did a great job of really highlighting what overcrowding meant in terms of the spread of COVID, how focused this was on communities of color that we knew. I mean, if you step back, you could have said, this is going to be a problem, this is going to be a problem, this is going to be a problem. And I think stepping back and making those connections, the work that's being done to get information out about vaccines is tremendous. My understanding is that the county had 120 people going door to door on the east side and then in South County. It kills me that they weren't also distributing information about eviction protections. It pains me that they weren't also doing outreach around the program that Destination Home was doing simultaneously. And I know some of that was there, but I feel like we missed a moment to bring these pieces together so that we were really building a foundation. And so that was something I think I should have done a better job of in my job. I know everybody was doing their piece and pushing these things, but that's really the reflection that I have is that things are still really, really hard, and people are busting their butts to make it work. But you always look back and say, you know, if we'd sort of done this a little bit differently from the beginning, you know, would we be in a better position moving forward?
Thank you, Mathew.
Well,
Helen,
Mathew, can I just say, Mathew, I think you really have the opportunity with opportunity housing as it stands isn't necessarily going to be necessarily racial equity or low income effort. Doesn't have to be at all, right? That to me seems like an opportunity to not miss, right? And that's as that's starting now.
Absolutely. Helen, any last kind of wise words around this? And then I'm going to open it up to folks on the call.
Yeah, so I actually started this particular role in October. And so my track record is very short, but I mean, looking back to, I think it's been maybe, I guess, 5 or 6 months now, I would say I wish I had more confidence at the beginning, in the sense that, not in terms of personally, but I think it's just the scope of the work is so large and there's so many moving parts and factors, past context, relationships and things like that, that I just was initially overwhelmed with trying to capture. And I wish I had more confidence to fly the plane while I was building it. I think there was a hesitancy with trying to like continue to build the plane and like fly it a little bit just to test it, but not really full send and fly. And I think that's something that I definitely have told myself that is going to be my priority moving into January, into the new year, which is, it's okay if I don't have all the pieces or know all the people or have all the backstory of what happened. Like I said, I started this role in October. I'm going to just keep flying. And I would say that for anyone who's starting a new advocacy department, or anyone who's coming into it's without an organization, just stepping into the world of civic engagement, policy, and advocacy, who wants to be involved, the back context, it's fine. Just get involved and start asking questions.
Thank you, Helen. So that's a perfect segue, asking questions. What questions do you all have for the panelists? And I'm going to try to be able to see you all. So I know there's an invitation to use the hand function, wave in the camera, get yourself off Zoom. Don't be shy. I know this isn't a shy group. That I know for sure. What questions? What questions? I'm trying to get to a view where I can see you. Okay, I think I can see you now. What questions, curiosities have come up for you all? I have some in my back pocket, but I'm gonna let it sit. Questions, curiosities. Any? I know.
I have a quick question. I have a quick question.
Yeah,
For some reason, I tend to join nonprofits that are somewhat broken. I've talked to a few of you about this, Darcie, Helen, and so forth. And my question is, as I'm working to get those nonprofits back on track. Like, how can we kind of get into the fold and get involved? For instance, I was with a nonprofit called Foothill Community Health Center, and we had 16 health centers in East San Jose. And I dropped in CEO, and we kind of fixed things up and merged with another one. And now we serve 105,000 patients with a $100 million budget. And you know, we catch cancer every day, with over 1,500 visits a day. So we provide vaccines, we do testing, all this sort of stuff. And I think we could potentially help out. But you know, for historical reasons, we haven't been in the fold. And that's the same. I'm also president of the County Black Lawyers, same thing there, and a trustee on the Santa Clara County Bar. And it's the same thing in all those organizations. They've had some rocky histories, and you know, are on their way back, trying to recover. And as that happens, how can organizations like that kind of get back into the fold?
Panelists, who wants to dive in?
Well, I can speak from experience. I mean, Santa Clara County is a lot about relationships, but it's also a close-knit community, whether or not it's over 1 million people. But oftentimes to get into the fold probably is to find someone who is in the know and on the go and knows the people, because oftentimes they are at tables, if I'm answering your question, speaking to people whom are already running things, creating access. A lot of tables that I was invited to is because someone who was at the table spoke my name, or they said, you should check out this organization. And I think oftentimes here is relationship based, but it's also political in the sense of people are connecting with other people to create access. And so if for any of those organizations, like when we revived AACSA, which is a 43-year-old organization, but when I was hired as executive director, someone mentioned when we thought it was going to close. But it was, you know, being able to start creating these pathways and connecting with folks. So I would just make that recommendation for any organizations who are on here that are small and trying to figure it out, is start creating relationships. Reach out to your elected officials, for those whom you vote for, to create a space for you at the table. And if not, like Shirley Chisholm said, just go ahead and start bringing your own furniture. And people will start recognizing that you're there. At least the new generation is saying bringing their own furniture. Shirley said bring your folding chair. So that would be my at least recommendation to those organizations and/or an organization like you are mentioning.
Thank you, Milan. There's a question in the chat that I want to just lift up here, and I know we're running up on time, but says anything the panel wants to say about the extra effort and work it takes to partner with other orgs. Looking ahead, what strategies are there to deepen these effective partnerships, and what resources will be needed to support that work?
It takes a lot of energy. Oh, go ahead, Jen.
Well, and I have to drop in a minute. I'm so sorry. But what I wanted to say was it takes really transparency and communication. And we were so grateful to having Zulma Maciel with the City of San Jose, who helped bring folks together for us. We are so grateful to all of the time that the partners had to spend like talking about things and the amount of time. And I think I should have underscored this more deeply. And you know, Sacred Heart Community Services, Poncho and Aaron and Lydia and the team, them taking on such a huge piece of this work and us working in such partnership all the time together. It requires trust and communication and really putting others ahead of yourself.
Milan, were you going to add something as well?
Oh, yes. I was voted daydreamer in high school, but anyway, look at me now, oftentimes people who when you don't learn history about historically Black organizations, you kind of miss the mark on how to approach them. A lot of Black organizations that are national have local organizations here on the grounds who administer national-based initiatives in the area. And so AACSA has always known about these organizations because they've served with us. So the approach to partnership with the historically Black fraternities and sororities is rooted in understanding how Black organizations navigate through community. So when people move here from Washington, D.C., and they say, hey, where are the Black people? AACSA has a relationship and an understanding historically on where to find the 100 Black women of Silicon Valley, or Jack and Jill of America. So it's knowing history, but also being able, as she said, collaborative and transparent, because a trust factor already within our community, being here in America, has always been about trust. Can I trust that, you will not do something under the table? Or can I trust that when we go in on this partnership, we can come out, equally the same? So trust, transparency, and like I said, history and knowing about what you're asking of organizations of color, communities of color, being a little bit aware already and doing your homework and your research, and not just asking us to teach you for free. You should be paying us for our time and for our knowledge, just as everybody else is paying other folks.
That's right.
And so just to kind of add on to that, I am also a firm believer of reaching out to institutions such as, the D9 or the AACSA or the NAACP or so on. But I also challenge people to consider how they define stakeholders, in the sense it's like sometimes it's not really a collective organization, but it's like, how do you find people to build coalitions who are within the area of interest or who have a shared interest with you? And so, for example, and I just use this as an example because I was working on this recently, like the African immigrant community. In the Bay Area, there's only a couple, and they're mostly East African. So it's hard to find Central African, not necessarily Northern African is more mixed with Middle Eastern, West African and Southern African diaspora communities. So it's like with communities like this, it's like going to the restaurants, going to the little local markets and so on, and building coalitions through individuals, and then from there creating partnerships with those collectives. That is also another way, outside of, of course, the regular, going to already established long-standing institutions that you can find locally.
Thank you for that. What comes up for me as we close our conversation is I always like to ask people what their superpower is. Like knowing what is your superpower as an individual and as an institution, and figuring out how do you offer up your superpower to the movement, to the advocacy that's happening. Because I think we can all agree, everyone in this room, because that there really is room for all of us, and none of us have it all figured out. And we need your superpower. So with that, I just want to say thank you to Milan, Helen, Mathew, Darcie, Jen. I think this year has been hard for all of us. And part of the reason why I am just so proud to be a part of Santa Clara County is because it has leadership folks like you all who are making, that are making shit happen. So thank you. And thank you to the Council of Nonprofits. So thank you, panelists.
Thank you, everybody.
I'm turn it back to the Council of Nonprofits to close us out.
Just wanted to say a huge thank you once again to everyone for sharing all of your stories. Like, we know that this is stuff that we're really just getting a snapshot on the much longer story behind it. A lot of stuff that was a lot of blood, sweat, and tears behind these stories, but we really just wanted to make sure that we offered up space to uplift these stories. And we know that hopefully all of the attendees today and all those even watching the recording even after could take something away from it and take it into their own advocacy for the future. Because I'm sure that there are many stories from people on this call that we're not even fully even aware of yet, and there's a lot of lessons to be learned there. So thank you again for everyone for sharing all of your stories. And thank you again for all of our attendees for listening to these stories that deserve to be uplifted.